Welcome, everybody, to another episode of the Future of BizTech. I'm your host, JC Granger, and I have here with me Stephen Charlap, who is the founder and CEO of Soap Health. Now, I could go into it myself, but I'm going to let the pro here tell us everything about himself and what he does. So, Stephen, thank you so much for being on the show. Tell the audience a little bit about you and what is Soap Health and who do you help?
Okay. Well, glad to be here. Thanks for having me. Soap health is probably the biggest change in primary care in the last 50 years. It is a digital human powered platform that is meant to give the world population 24/7 access to affordable and accurate primary care. It may very well be the next $1 trillion or the first $1 trillion product in healthcare. My name is Steve Charlap, as you said. I'm a serial medical entrepreneur. I have an MD from NYU, an MBA from Harvard. I was a Stanford Fellow. This is my third startup, but this one, unfortunately, was born out of tragedy.
Oh, so
I lost my older brother, a practicing cardiologist, to a misdiagnosis.
oh, man.
And after his passing, I spent 3.5 years at Stanford, 2 years at Harvard, trying to understand everything I could about diagnosis and misdiagnosis, and started Soap Health over 5 years ago to address this global problem. SOAP, by the way, stands for Subjective Objective Assessment Plan. It's essentially what a doctor does. He or she gathers subjective information from the patient, combines it with objective information that's available, needs to be created, makes an assessment, and creates a plan. That's what we've built.
So is this something that's on the consumer side that they're accessing, or is this internally at hospitals for doctors to be able to more efficiently and accurately help their clients and their, and whatnot?
Okay. So I'm first a physician, and the first rule of medicine is first do no harm.
Hmm.
And so we built this initially for physicians because physicians, unfortunately, are having a very rough time. They suffer from reimbursement challenges, time constraints, knowledge gaps, decision fatigue, communication errors, over-empowered patients, etc. And they unfortunately don't have enough time to spend with their patients. They do relatively curtailed intakes, and they are ultimately in a position about 30% of the time not to get the diagnosis, and 5 to 15% of the time to get the wrong diagnosis, the result of which is roughly 400,000 people a year die, another 400,000 become permanently disabled from these misdiagnoses. And the problem is so bad that the National Academy of Medicine now predicts that everyone will experience a misdiagnosis. Here in the United States, we have a major shortage of primary care physicians, and mid-level providers, nurse practitioners, physician assistants practicing primary care now outnumber primary care physicians. And this problem is expected to get worse as very few medical school graduates are opting into primary care because of the reimbursement and work challenges. And so it's reported that over 100 million Americans already do not have access to consistent primary care. And across the globe, it's 4.2 billion people, according to the World Health Organization, don't have access. So after losing my brother, who was the brother who shared a bedroom with me growing up, the brother who let me put my head on his lap during hot car rides, the brother who bought me birthday gifts and always looked out for me and always mentored me, my goal is to save 1 million people from premature death in his memory. And the only way to do that, based on everything I learned at Stanford and Harvard, and consequently, is to build something that is better than doctors. Today is going to make doctors the best version of themselves, but as primary care doctors continue to disappear and vanish for retirements or career changes or fewer people entering the field, we'll be able to step in autonomously and provide primary care.
That's That's an incredible story, and I'm sorry to hear about your brother. I think what I find interesting is that the amount of companies that start from tragedy or necessity, right? And I think they're some of the best products that ever make it on because it started by someone who has the passion for it, right? It's not just some business model. Every day I'm sure you think about your brother when you're doing this. So I do have a question about maybe early on then. So we know why you started Soap Health. So I guess my next question is, what was it like early on in the kind of the client acquisition journey? Like, did you find that it was hard to enter the market? Did everyone just love it automatically? How did that go in the beginning?
Well, go back 10 years ago, AI was still basically science fiction. We had facets of AI, but until ChatGPT came along 3 years ago, AI essentially wasn't accessible by the average person. But I've been working on it for 10 years. And so I saw facets of AI long before most people did. But AI was still looked at suspiciously because we've been talking about AI breakthroughs for 50 years.
Mhm.
And there was a whole hyperbolic period where everybody was talking about AI and then it kind of fell out of favor. But meanwhile, we were seeing advances in terms of in the 1980s, Gary Kasparov said AI would never beat a chess master. By the mid 90s, it was consistently winning at chess. And other algorithms and machine learning. When I was at Stanford back in 2015, I already saw early aspects of AI being applied. But most people fundamentally believed 10 years ago that AI could never stand in for a doctor, that a doctor represented this almost perfect specimen, almost free of human error, almost free of humanity, although they were supposed to be extremely empathetic and could give you a hug and look you in the eyes and reassure you that things were going to be okay. And some doctors match that description,
Mhm.
but only some. Many do not. And particularly when a doctor is rushing through an appointment, staring at their computer screen, you don't feel the love, you don't feel the empathy. And it's not their fault because, adjusted for inflation, doctors made the same absolute dollars 50 years ago, and adjusted for inflation, they're in essence making 20% of what they used to make. So they need to see so many patients just to make what they were making 50 years ago in absolute dollars. Now, subject any profession to that, and you're going
Yeah,
to break their souls.
that's true. No, I agree. How did you, I guess, how does Soap Health make money, right? Like, how are you charging the providers? Is it like per message? Like, are you just doing that like that a fraction of a cent
No,
or something, or is it yeah? Walk us through like how if someone listening from the healthcare industry and they want to say, well, let's look into Soap Health, like how does that structure work? Even if you don't want to talk about exact pricing right now, because I'm sure it's
yeah.
dependent on the.
So, as a mission driven company, it is extremely important to each and every one of us that Soap Health remains affordable for every person on this planet. And therefore, we need to be very conscious of the way we use AI, the way we provide the service, and also what we charge for it. So we are, by all estimates, undercharging for this product because we want to overcome physician wariness about AI replacing them. And I believe that we've already built an application that a physician who is able to use it does himself or herself, and particularly their patients, a great disservice not using it. However, the truth be told, we have been very restrained in releasing the product in the market. There are users, but they are handpicked and carefully vetted and supervised to ensure that no one is harmed by the product, because the first rule of medicine is first do no harm. And on a personal level, I take no compensation. I retired 17 years ago. I've invested millions of my own money to achieve a 1 million patient life-saving from premature death or permanent disability. And so I may very well be the most committed person on earth to eliminate misdiagnoses from medical practice. Malcolm Gladwell once said you need 5,000 hours, maybe it was 10,000 hours to be an expert.
10,000, yeah.
10,000 hours to be an expert. I've got 20,000 plus hours into this endeavor. I wake up and go to sleep thinking, how do we eliminate misdiagnosis? How do we make the existing and scarce primary care physician the most productive, the most rewarded, and the most accurate version of him or herself?
So it sounds like you've taken it slower on purpose to avoid, because again, like for example, hallucination is a problem, maybe not necessarily severe in scale with AI, but for what you're doing, it doesn't have to be severe in scale. It's kind of like, well, there's 20,000 flights a day. If only one crashed, that would still be 9.99.9. It's like, yeah, but you can't have one plane go down a day. Like it's still too much on the downside there, right? So, is that why you've taken it a little slower and you've had it, like you said, specific people? Because are you still not satisfied where the technology is in order to say, okay, we can let this scale and we can let everyone have it? I mean, and then how close do you think you are to that, where you think it is now safe enough to release on a bigger scale?
Yeah, I think by the end of June, we will have a pristine version of the
Wow.
application.
That's quick. You're going to blink and that's here, right? So,
I say the end of June now. It won't be sooner. I hope it won't be later, but we have thousands of patient users. We also have an application being used now by 80,000 plus patients in the United Kingdom that we're bringing to the US that eliminates medical office calls. The goal here is to get it right. Okay.
sure.
There is no minimal viable product. There is no shortcut. This is people's lives. I would say, God forbid, someone should put a product in front of another human being that potentially can ruin their lives. Okay. I'm not afraid of liability. I should be, but I'm not afraid of liability. I'm afraid of hurting someone. Look, in my first company, we provided medical services to elderly patients living in nursing homes. I gave my personal phone number out to every single family member that signed up with our service, several million times. My cell phone number, because I feel that when you do something in healthcare, you need to be front and center of those efforts, because people are putting their trust. And it says on my LinkedIn profile, to save 1 million lives of people I will never meet, because they will, for all intents and purposes, stay strangers. But I will know that I did right by them and I did the right thing.
I like that a lot, and I did see that on your profile. It's one of the reasons I actually wanted you on the show, to be completely honest, too. We try to only interview like the interesting things, right? And when you have a one-liner like that of that kind of passion and mission statement, that intrigued me anyway. I will ask, what about the struggles? I'd love to know, through the last 5 years, what were some of the biggest hurdles that you came across, and how did you get past them?
Yeah. Well, my favorite saying is knock down 467 times, get up 468. To be an entrepreneur is to expect nothing to go to plan, everything to take longer, everything to cost more money. Okay. People to always be the confounding factor, and to take advantage of luck, wherever and whenever you can find it. When people ask me, how's it going? I always answer the same way, pushing boulders up hills. And I use that particular analogy because from Greek mythology, there are two people that I think of pushing boulders uphill. One was Hercules, okay, capable of pushing a huge boulder up a hill, a Herculean effort.
Mm-hmm.
That's how I describe soap. The other one was Sisyphus, who was doomed to push a boulder up a hill, only to see the hill, the boulder come rolling down and start over and over again.
Mm-hmm.
I say an entrepreneur has to very quickly figure out, is this a Herculean effort or a Sisyphean effort? Okay, so you got to have a certain amount of optimism that if you only can muster that Herculean effort,
Mm-hmm.
you're going to succeed. But you got to be wary of, is this a fool's errand? Is this futile?
Yeah, I've called it delusional confidence because I think delusional confidence is the only thing that successful entrepreneurs all have in common. Because if you think about it, right? And I don't care what business you start. I mean, I've been in marketing 25 years. I've had my agency for 14. If you tell an entrepreneur, here are the odds, there's a 95% chance that within the first 3 years of your business, it's going to fail. And then people, crazy people like us are like, cool, let's do it. I mean, imagine doing that with anything else. Imagine getting in your car and there was a 95% chance you're going to get in an accident. And you knew it before you got in the car. You probably wouldn't get in the car, right? Jumping out of a plane, they're like, hey, there's a 95% chance your chute isn't going to open. And yet idiots like me and you, we say, we're going for the 5%. We know we can do it. And that's that kind of delusional confidence, but you need that in a way to have that relentless nature that it takes to keep pushing that boulder up the hill, like you said, right? And so I laugh about it, but this is another reason I like interviewing other, startup founders or CEOs because it's like, no, I get it, right? I mean, it doesn't make any sense. If it wasn't for our passion, we would have no gas in the tank because it would have beaten us down so long ago, right? Even if you have a what I call quote unquote a boring business, right? Let's say like it's a like waste management is a boring business, but they're multi-billion dollars. But they were passionate about business itself, the structure of it. The people who made it into what it is now, they acquired it at certain when it was in the early stages. And that's what they were passionate about. They were passionate about acquisitions and growing things. And I thought, okay, that's interesting, right? I'm like, I get why they did it because that's where they were at. And with yours, I mean, I don't think I've met anyone that has a more personal drive story to start the company that they've started. I mean, you probably be on the top three minimum of anyone I've ever talked to because I get that, right? We have a family member that dies from something that you believe is completely preventable and you don't want this to happen to anyone else. I absolutely love uh, that kind of origin story of it.
Well,
But
I didn't tell you the whole story because the
okay.
whole story is then I lost a very dear friend, my wife's best friend, another physician, to another misdiagnosis.
Oh, geez.
And then I almost lost my life to a misdiagnosis.
Do
And
you, do
more
you mind?
recently, I lost another brother to not a misdiagnosis, but he was mishandled by the medical staff in the hospital. And I fundamentally blame them for his dying. So you're looking at someone who unfortunately doesn't have a lot of faith in our existing medical establishment. And I'm sorry to say that, but I would say that of the last dozen or so physicians I've gone to, that legendary empathy has only been there twice.
Hmm. That's not a lot of times. I mean, you you are a doctor. Like
Correct.
you've been doing this for decades, and you only can think of twice. That's
Yeah. I'll give you an example. I was having this strange pain going down my back, radiating into both legs. I thought maybe I'm having an aortic aneurysm. That is potentially one of the symptom presentations. Or it could just be something going on in my back. So I go to the emergency room. And the emergency room doctor says, okay, let's get a CAT scan done. And I say, I really don't want that radiation from a CAT scan. An ultrasound would suffice. She goes, yeah, but a CAT scan is the more definitive diagnostic test. I said, yes, but there's a toss-up here between whether this is an aortic aneurysm or just something going on in my back. And she says, fine. So we'll do the ultrasound. And the ultrasound shows that I don't have an aortic aneurysm. And she says to me, the truth be told, I try not to do the CT scan in younger patients, but it takes about 20 years for the damage related to a CT scan to get done. And I'm thinking, I was about 50 at the time. And I'm thinking, so you got me dead at about 70? I said, that's really nice of you. I didn't say it to her, but that's what I was thinking. And just an example of why do I need a CT scan? Because it's better for you. It's not better for me as a patient to be exposed to that type of radiation if I can avoid it.
Yeah, you
Well,
do the ultrasound first and then decide from there if you need to upgrade to a more intensive, scan.
right. But again, the fact that she then rationalized why I needed to get a CT scan and somebody younger would get an ultrasound was a bit mind-boggling to me.
Hmm.
Another story, I had hip surgery. I had self-prescribed myself medication about a year earlier, which I had discontinued because the side effects were no good. And I'm in the hospital, and being an ever curious person, they go to give me the medication. And I say, what are you giving me? And I say, oh, I'm not taking that. Can you please update the record to show that I'm not taking that any longer? I self-prescribed it. 5 more times. They tried to give me that medications in 2 days. 5 times. Anyway, I don't want to, rag on the medical profession. They try really hard. They invest a lot of time in becoming doctors. They come out all doughy-eyed and hopeful and idealistic from medical school. The residency starts beating the crap out of them. And then they go into the real world between dealing with the insurance companies, dealing with the bureaucracies, dealing with patients. I read something 2 years ago. 9 out of 10 doctors reported being physically or emotionally abused,
Mm-hmm.
physically or verbally abused by patients.
Yep.
Half of patients lied to doctors in the United States about things that might embarrass them. They're afraid of being negatively judged by their doctors. Okay? And so they don't tell the truth.
Mm-hmm.
This is a very unfortunate state of affairs. And
Actually,
then put on top of that,
let's talk about that really quick, if you don't mind. I'm sorry, because I do want to make sure that that's a really good point, though. Does your software, does your processes help alleviate that embarrassment so that they're giving, I mean, is that how we really fix it? Because again, I know doctors too, and I know nurses, and you're right, people lie. And it's like, well, if you don't give me the truth, of course I'm probably going to misdiagnose you because I'm only going off the information you're giving me beyond what I can test for. And not everything is necessarily testable, or even if it is, it's the other information that combines with that tells me that what I can diagnose. And so how does your system help alleviate, at least, and to what percentage would you guess, that embarrassment slash lying percentage that goes on?
there's a mountain of scientific studies that show that when a human talks to a digital human or believes they're not talking to a human, that they are considerably more truthful and more talkative, more verbose. They say more words. This has been scientifically proven beyond a shadow of a doubt. And so we collect the most truthful, the most accurate, and the most detailed intake than virtually any other methodology on the face of the earth. Now, if I was interested in money, I would have patented the use of a digital human as a job interview. Because it's the same thing. When you do a job interview, you want to get the most truthful responses from the interviewee. I only patented it for medical use. because all my attention, all my energy, all my resources are being applied to save those million lives in memory of my brother.
So let me ask you this then. Since you are coming up on kind of that acceptability level that you're looking for of the quality of your product, what are your plan? How about this? What kind of marketing are you guys even doing right now? Obviously, listen, I know that you're on podcast because you were telling me before the show you got like 3 scheduled today. So clearly you're doing PR. So we know that. What other types of marketing are you doing to for people to even to even know that you're out here? Because obviously you have to do it before you hit the point where you want to scale it. I'm just curious, what are you doing to get the message out there about your product?
Very little, because I have very little resources for marketing. And so choosing between sales, marketing, and product improvement, I have 46 people. All the money virtually goes to product improvement. Again, I am determined to get this right. I am determined to build something never been built before, to work incredibly accurately, to be reliable and trustworthy. And whether somebody turns it into $1 trillion company or not is of no concern to me. I don't need $1 trillion. I don't need $1 billion. Okay. I made enough money to put food on my table, a roof over my head, and live comfortably. Okay. I just want to solve a problem so nobody else cries for years after over a near and dear brother. And by the way, my brother would have enjoyed 17 great grandchildren,
Oh, wow.
not great grandchildren, excuse me, 17 grandchildren if he was alive. He only met 2 of them.
Well, that's a pretty that's an incredible story you have for your product. I personally am looking forward to seeing it come out on a broader scale anyway, hopefully in the next couple months, like you're saying. The last question I want to ask you here is, you've been through the gamut as a CEO and a founder. If there was one piece of advice you could give anyone listening that is maybe thinking about going out on their own through a passion project or something of that nature, what would it be? What would be that kind of that one thing that you want them to know?
Well, you use the word passion, and I would say because things aren't typically going to go as expected. Sometimes you get lucky. Okay. I wouldn't depend on luck, but sometimes you do. Usually you're going to work really hard and you're going to do a lot of unanticipated things. And things are not always going to be golden, and bad things are going to happen, and setbacks are going to happen. If you're not passionate about it, it's really going to be tough to get knocked down and get up again and get up again and get up again and get up again. So do something that you really care about and something you're very excited about. But you mentioned this delusional confidence. I also say it's really important not to lie to other people, but there's nothing worse you can do than lie to yourself. Nothing. So don't have delusional confidence. Okay. It's okay to be optimistic. It's not okay to be delusional. Don't bet the house. Don't bet the farm. Don't put your marriage at stake. Don't put your friendships at stake. Don't put your children time and experience with a parent at stake. That isn't worth it. Success that should never be at any price. And I'll tell you that as a father who pressed his kids to be exceptional, and each of my kids is exceptional, I'm not sure they will forgive me for making them exceptional.
Well said.
Oscar Wilde once said, when they're little, they adore you. When they're teenagers, they judge you. And when they're adults, they may forgive you. I'm not sure they're going to forgive me. Not the PhDs, not the top jobs in a tech company, not the promotions, not the incredible compensations. I push too hard. Okay. So there's a balance. And I say that as somebody who doesn't seem to know balance. okay? You got to have some balance. It's okay to go all in, but you got to have some balance. I would not sacrifice any meaningful relationship for business success. Not with a parent, not with a spouse, not with a child. That's my perspective. That's the advice I would give.
Well, I appreciate that, Stephen. I appreciate you sharing your story too with us, and obviously telling everything about Soap Health, which I hope takes off massively here in the next couple of months, like I'm sure you're hoping it does. Listen, if for people listening right now, where can they find you personally? If maybe they heard something they like, and maybe they're a hospital or provider, and they want to reach out to you, and then also how can people find your company itself?
Well, the company is SOAP, SOAP dot health, HEALTH. Come to our website. Really doesn't do a great job at explaining everything we've developed, but don't want to spend a lot of money on marketing in the website. But it'll give you a good feel for the way that we've approached things. In terms of me personally, Stephen Charlap, CHARLAP, MD, MBA on LinkedIn. Okay. Please don't try to sell me something. Everybody and their mother is trying to sell me something. I don't like to be rude to people. I like to try to respond. I like when LinkedIn allows me to just click no thank you, try to say no thank you to everybody. I think that's the human thing to do. But if you want my help, I am always willing to help another human being.
Wonderful. And listen, everybody for who's listening right now, thank you so much for listening to the episode. If you like what you heard, give it a 5-star rating, share it with anyone else. Make sure you follow it, subscribe to it, and so other tech nerds like you and I can find really cool podcasts like this. So again, Stephen, thank you so much for being on the show, and I look forward to talking to you soon.
All right. Thank you.